Now, from the studios of Into Tomorrow in Miami, this is ITTV.
Our next guest's online and mobile platform connects patients with healthcare providers to deliver affordable telehealth access. I like that affordable line, especially for primary and urgent care, as well as behavioral health services. The CEO of a company called Laso Health is Tim Kaufeldt. Tim, welcome into Tomorrow. How you doing, sir?
Hi, Dave. Thank you very much. I'm doing good. It's exciting here in Austin at South by Southwest, and just happy to be talking to you.
And we're happy we caught you guys on the show floor. This product, as I understand it, fills an important need that has been seriously, I think, underserved by traditional healthcare. So tell me a little bit about Laso Health, and then let's get into what you're doing there at South by Southwest.
Absolutely. So our founder, Dr. Mazzani, about 6-7 years ago, just from his experience as as in his residency as a nephrologist, but also as a business owner and then a practicing doctor, all the failings in the healthcare system. And he really wanted to address, why don't people go to the doctor in this country? Because we don't. We do everything else but go to the doctor. We'll walk around for a stomach ache for days. And so about 3 years ago, he brought me on board to help make this dream a reality of his. And what we really looked at was, why do people not go to the doctor? And we came down to a bunch of the barriers of cost uncertainty, the navigation of the system itself that sits between us and the doctor, as well as the access that you need to see this person, All of those things create barriers, and they're all created by a system that was codified into law into 2009 that quite honestly is not going to change on its own. So he set out to change it, and our mission is to take what's costly, confusing, and make it affordable, available, and accessible. And that's why we're here today. We're launching a brand new product called Laso Plus.
I love it. And first of all, one of the things that I absolutely can relate to, as many people can, I mean, I love my primary doctor. We've been friends since long before he was ever my doctor. Yeah. But it's always the same thing, and people relate with their primaries. You discuss some issue, and you should see a specialist. Well, why did I come here? you gotta wonder. Exactly. It's like, but you're my doctor. Yeah. Can't you help? Well, no. Everything seems to be specialized. So I'm wondering how you guys tackle those issues.
So that's exactly it. And what you just said, in terms of, that's the navigation, that's the access piece. So the original app, Laso, that we started building 3 years ago, based on a simple concept, we find providers, dental, medical, wellness, that are willing to put an upfront price on all of their services and allow people to come and book those appointments directly with them. So with the original Laso app, let's say in your case, you twisted your ankle, you have to see your primary care before you can see an orthopedic. All of that's controlled by insurance companies, et cetera. Yeah. Whatever your plan is, if you even have insurance. And with Laso, what we did is we put all of that into one app, where that ortho will put a $75 30-minute appointment on there, and you just book it and go straight to him. You already know the cost. It's on your terms with time. And you don't have to have that referral. It is direct access healthcare. And what brought us here today is the expansion of that mission. Is Walmart Health saw our app at a conference about 6 months ago and loved what we were doing and asked, how could they are disrupting healthcare big time in their stores with point of care. How can we work together to take this to the people? And we got together to create Laso Plus, which is they've built a 50-state network of doctors in behavioral health and primary care, urgent care. And what they did is we have access to that network now to give people point of care. But the bottom line is it's the same mission. The cost is up front and included. You're never going to have another bill, that you can directly access it without having to go one place or the other first. And quite honestly, the convenience of being able to book an in-person appointment from your phone, but with Laso Plus, not even leave your couch to talk to an urgent care doctor in 18 minutes, right? So that's the idea with Laso Health. It's the convenience, it's the price transparency, and it's the access without navigation. So
And your partnership with Walmart and Walmart Health, right away you tend to think in terms of, spend less money and Walmart. They go together, right? For the most part.
Right. Yeah. Their whole, their whole mantra as an entire company is just making people's lives better.
Yeah.
And healthcare is 1/5 of our GDP, and nobody knows what it costs. It is the most insane thing.
Oh.
And what we did with Lasso, whether you're talking about Lasso Plus or the original product, or even our discount prescriptions, what you're really talking about there is something that exists entirely outside of the United States healthcare system, outside of the insurance system, rather, and is really empowering consumers now. They are able to consume healthcare the exact same way they consume everything else in their life.
Well, and that makes perfect sense. And I'm hearing my audience in my head saying, yeah, well, telehealth really isn't new. I mean, it really got more and more popular with the pandemic because no doctor wanted you to go into their office anyway. But affordable telehealth seems to still be out of the reach of many consumers. But you guys are addressing that issue.
Absolutely. So working with Walmart, we came up with the concept of streaming healthcare. They provided the network. We came up with the idea, and bless them for allowing us to package this the way we wanted to in an innovative way. So what we've created is what we call streaming healthcare. It's a monthly membership starting at $16.99, topping out at $29.99, $0 visits, no caps on the number of visits, and no surprise bills after because insurance is not involved. So what you have is basically the Netflix of healthcare, is that you will never get another bill from that. And it's only month to month. There's no long-term contracts. There's none of that. So, think of a young person, an uninsured person, somebody between jobs, but also employers. We're saying to employers, give your employees access to this platform, Lasso Plus. Give it to them day one. It's $25 a month to employers. Give it to them day one. They have access to all these, including behavioral health. And it trains us, it deconditions us, it trains us to go there first. And then you use your health insurance when it's absolutely necessary. Most of America is on a high deductible health plan. If your deductible is $5,000 and you don't have $5,000 in your bank account, you're actually not insured. And we try to tell people that all the time. It's functionally uninsured, but that is the issue with the system. It's controlled by a select group of people. The doctors are victims in it too. And so what we're looking to do is really just create almost an alternative healthcare system that saves people money, but more importantly, gets them to seek care.
We're getting a lot of nodding heads in our control room, too, because I think everybody can relate to what you just mentioned there as well. So you're saying you're not suggesting getting rid of, if you've got some health care, don't get rid of it. But maybe you can get a more affordable plan because you don't need to visit so frequently, or you don't need to be going to a primary first and get a referral, go to a specialist. I mean, it's enough to drive any of us nuts. But you
Absolutely.
Again, now behavioral health. But now, if someone still absolutely needs to visit obviously a facility, a doctor, or what have you, you still have that capability, but you're not doing it through Laso Health, or you are?
So we do have that capability, but it's only in San Antonio and Austin right now, in select markets around the country.
Okay.
Our dream, though, is to one day build out those networks of really great physicians, and I'm not saying that in a dreamy way. The providers that are willing to put a price out there on their MRI, on their sports physical for your kid, on your ingrown toenail removal, which is our #1 procedure.
Really?
It is the biggest indictment of the healthcare system that we will walk around with those for decades in total pain, but it's not worth engaging the system to be taken care of. As soon as we put a price on that in our app in San Antonio, we didn't even advertise it. That was the one that got everybody in the door.
No way.
So, it's crazy, but it is an indictment of our system. Anyhow, it's so exciting for us. And it's great to have a partner in Walmart that is amazing as they are. They truly are dedicated to changing healthcare in this country. And we hope that this streaming healthcare model, it may sound like a marketing gimmick, but it's really what it is. All 50 states, any device, and at a price point that, quite honestly, everybody's already paying for Netflix and Hulu and everything else.
Yes.
So there's really not an excuse not to see a doctor now. And that's what we're trying to create with Laso and Laso Plus.
And I love the Netflix analogy. I think it works. We can all relate to that sort of thinking.
Yeah.
And you are really helping patients to become their own healthcare advocates, right?
Absolutely. What people don't know is this, is that as of 2022, us, me and you and everybody in your control room, everybody in your audience, we are the biggest payers into the system now at 28.4%. Federal government, 28.3%.
Oh.
Our out-of-pocket deductibles, premiums, copays, all up over 200% since the passage of the ACA. I would only ask your audience to think of one thing. Consider, if you're on a high deductible health plan, please treat your health insurance the way you do your home insurance. If you have a leaky pipe in your house, the last thing you're going to do is call your home insurance agent.
Yeah.
Why? Because next year your premium goes up. And I have nothing against health insurance. God bless. Great insurance with this company. And in 2021, my family had a crisis. I've got $300,000 of EOBs on my desk right now. God bless health insurance when it's needed. But for regular care, it's a horrible means of a system. So,
Very good point. Laso Health, Laso Health.com. And of course, we'll get you there when we link you, when you visit us at intotomorrow.com. Tim, as CEO of Laso Health, we wish you well. And I like how in a perfect world, your dream is to make sure you've covered everyone this way all across the country. But everyone all across the country can take advantage of what you're doing now, right?
With Laso Plus, absolutely. Laso Plus is all 50 states. And think about when you're vacationing or traveling for work. You leave your meds at home. You can get an appointment in 18 to 20 minutes with one of their network's urgent care providers, and an hour later the prescription's down at CVS. It's seamless. That's the type of frontline care that we're trying to deliver for less than $1 a day. We'll just call it that. We'll sell it the old school way. Less than $1 a day, you can have access to mental health care, primary care, urgent care, no visit fees, no limits, and no surprise bills after the fact.
Excellent. Thank you, Tim. We appreciate you joining us. Again, Laso, our pleasure to have you. LasoHealth.com. Again, we'll get you there. Visit us at intotomorrow.com. I'm Dave Graveline. Stay tuned. Much more to come, including from South by Southwest, as we bring you further into tomorrow right here on the Advanced Media Network.